All right, my name is Sarah Terrell, and I am in the BSN program at Columbus State University, and in my senior project course right now, we're focusing on national patient safety goals. So we're going to focus in on one in particular. National patient safety goals are set into place by the Joint Commission, which is our accrediting body at most facilities, but definitely at the hospital where I work, which helps us keep our accreditation, keeps our doors open, and keeps us treating patients. So as you can see, they focus in on national patient safety goals every year with attention placed to special issues that we need to focus in on to help our patients. So the national patient safety goal I chose to use for this assignment was 07.05.01, use proven guidelines to prevent infection after surgery. Since I am in the operating room, this seemed like one that was most pertinent to us. So the importance of surgical site infection prevention with our patient population is, as you can see here, it helps to decrease hospital readmission rates of patients, decrease mortality rates of patients, decrease hospital costs, and we maintain accreditation within the facility as well. So I chose to focus in on a case study out of Oklahoma City, Oklahoma. They saw a 78% decrease in surgical site infections over the course of 1 year by focusing on their management of patient care before and during surgery. There are multiple aspects that you can focus in on to prevent infection with your patients, but they chose to focus in on 3 in particular. The preoperative antibiotics to make sure they were giving the correct ones for the procedure that was being performed, the maintenance of a patient's core body temperature during surgery, which you want to keep at about 36 degrees Celsius, and the correct preparation of the patient's skin prior to surgery to include clipping rather than shaving and the proper aseptic technique to preparing the procedure. So what they saw was within 500 surgical cases, they had 1 surgical site infection reported, whereas previously they had 1 per every 50 cases. So they saw quite a dramatic decrease in their surgical site infections just by implementing these 3 procedures. In a case that I found called Surgical Site Infection and Prevention Guidelines, which focuses in on what the CRNAs do in the operating room, they found that there are 500,000 surgical site infections in this country every year. It is the second most popular hospital-acquired infection, which shows, as we mentioned earlier, that it increases your incidence of hospital readmission rates, patient mortality or morbidity, prolonged hospitalization, and increased medical expenses. These are almost always preventable cases, and so with appropriate patient education, surgical preparation, and preoperative measures, we can help to prevent this, if not eliminate it completely. So as you can see here, I've got a chart just showing national and regional demographics. Georgia is not very much in line with the national statistics, as you can see. Where we differentiate greatly is with our colon procedures, any bowel prep procedures that we have. We see a huge increase versus the national range, but we do look better than the national range on vaginal and abdominal hysterectomies, which are also these are the 3 most common procedures where you see post-operative infections. So this is really where we want to focus our attention compared to the national numbers, but with everything else we look good. We do want to decrease our abdominal hysterectomy post-operative infections, but we really want to hone in on the bowel procedures. So as you can see here, kind of focused in on some articles that talk about percentage rates, what we're looking at before we implement the areas for correction. So in need for change, trends in surgical site infection and general surgery at a tertiary hospital, they found that they saw approximately 8,000 surgeries in a year, which is a little bit less than what we might see here in Columbus, Georgia, but they were having a rate of 3.63%, which is approximately 27 patients that had surgical site infections in their general surgery population, which is higher than the overall standard rate of 2.62. So this study shows that even in the hospitals where we see less surgeries, we still have a huge room for improvement. They saw that they wanted to improve their rates by focusing in on strict intraoperative guidelines, meaning how we protect our patient when they're in the operating room and then their nutritional status post-operatively were most important for them. So you can see how there's some different things that each facility can do to help improve this for each patient. In another article out of Athens, Georgia, called Achieving Zero, they decided to focus in on what they could do differently to increase their rate of surgical site infections by 40%. They didn't find any common denominators amongst those that had infections post-operatively, so they chose to implement different procedures than they had done before. So that included new surgical dressings, new suture, and standardization of all processes amongst the staff. That facility saw within a year's time, from March to March, that the excess cost of surgical site infections was reduced from $250,000 to $40,000, and excess hospital days for the patients were reduced from 156 days to 24, and they had an overall surgical site infection rate of 0.7%, simply by implementing those processes into their hospital facility. So what can we do as nurses, as medical staff? I kind of came up with some ideas on where we can focus, where I feel like we really need the help in our hospital. The surgeon needs to discuss with the patients the importance of stopping smoking several weeks prior to surgery. This helps the body get proper oxygenation to help the healing process. Anesthesiologists would prescribe appropriate IV antibiotics rather than just a standard antibiotic. We have several different ones we can use, so we need to use the best one for that patient and for that surgery. Preoperative nurses will have the patient shower with appropriate cleanser prior to surgery. Rather than counting on the patient to do it at home before they come in, let's have them do it when they're in our facility and we can monitor that. Intraoperative nurses will shave the surgical site as close to the skin as possible with a one-time use electric razor, as well as decontaminating the surgical site prior to surgery, working from the surgery site outwards with a sterile skin prep. While our preps are always sterile, the actual preparation that the nurse does is not necessarily a sterile procedure, and it needs to be 100% of the time. An anesthetist will ensure the patient's body temperature remains at or above 36 degrees Celsius during surgery to encourage blood flow. What we should watch for. These are things that our patients can present with that we can't necessarily control. They can come in with these issues, with these diagnoses, and we have to work around them as best we can. Our diabetic patients, we need to monitor their blood sugar before and after surgery and treat as required. Our patients with COPD, we need to maintain appropriate oxygenation levels for the patient before, during, and after surgery. Our patients with end-stage renal disease, we just need to make sure that we're appropriating the right amount of IV fluids, not overloading them, but not limiting them either. Our patients that are in the obese range, we need to educate them on diet and exercise prior to and after surgery. Any little bit helps. Any amount of weight loss we can have certainly helps. Our ASA scores that anesthesia assigns, those are all related to your health. So the more of these that we can control, the lower the ASA score, the better the outcome for the patient. And prolonged surgery time, sometimes there's not much we can do about this when we run into complications, but certainly what we can do if the surgery is longer than expected is monitor patient's body temperature, fluid levels, oxygenation, urine output, and so on. And we need to make sure that we are using antibiotics appropriately. Again, not just the same antibiotic for everybody, but let's give what's best for that patient. Patient education, this is critical. We always want to educate our patient at every point through the process. We need to make sure that they understand appropriate wound care when they leave our facility, what to watch for as far as infection rates, so if they do develop one, we can treat it quickly. And we need to provide them education the best way they receive it. Written, verbal, video, we need to act it out, whatever it may be. Let's do it in a way that they best understand. So in conclusion, obviously there's multiple ways that we can help to prevent and reduce our surgical site infection rates, and it's just up to the facility themselves to find what areas are best for them to focus in on so that they can have better outcomes in the long run. I know this is something that we are focusing on at the hospital where I work currently, and we started at the beginning of this year, and we will compare our results at the end of the year to our results from last year, and hopefully we will see a dramatic reduction in our surgical site infection rate.